Caring for yourself and others hasn't been easy lately, but we want to remind you just how important it is to care for your smile.
At New Teeth Now, we're ready to help, and we're taking every precaution.
We're practicing social distancing and checking everyone's temperature.
All of our employees are wearing masks and during procedures are in extensive personal protection to keep you safe.
Begin your New Teeth Now transformation.
Good evening, everyone, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm here tonight with Dr. Kirkpatrick virtually. So we will go ahead and get right into things. How are you doing tonight, Dr. Kirkpatrick?
Hey, Bianca, how are you?
Very
doing
good.
well. Excited.
Good.
Going to get this thing started. And I think
All right, well, you can just take it away.
Your slide.
Perfect.
So let me get back to okay. So a little bit about me. Welcome everybody to the webinar. And as Bianca said, we are going to spend some time talking about implants tonight. If you have any questions, definitely submit those because we've got people that are communicating with me, so I can stop at various times during the webinar and we'll get those answered right here live tonight. A little bit about me. I did all of my school at the University of Kentucky. That includes dental school. And I did my surgery at the University of Florida in Jacksonville. And probably one of the most important things that you'll hear about me tonight, whether you come here to get treatment or you go somewhere else, make sure, just like me, that whoever would be treating you is board certified in our specialty, which is oral and maxillofacial surgery. It's kind of the way that we hold everybody accountable and make sure that everybody's up to the same treatment standards that we should be. So dental implants, we always get this question no matter, what the patients are coming in for, whether it's one tooth or replacing everything like what we're going to talk about tonight. Sometimes patients get confused on exactly what the implant is. A dental implant, it's basically replacing the root of the tooth, and it gives you or your dentist, a foundation to build the crown on, or us, the full bridge. And they are recommended, as the slide says, by our National Association as the best way to replace missing teeth. So here's a picture of what an implant looks like. This is very similar to the ones that we use. We use the ones that are shaped like a screw. There's a lot of different variations of these, but we feel this one's the best, and it basically goes into the bone. It's got threads that help the bone grow and attach into those various multiple threads on the implant, and it goes down into the bone. So the implant is the silver grayish structure here that is down into the bone that I'm moving the laser light on. Here, this obviously the gum tissue, and then what attaches to the implant is a little abutment or a post, and that is what the crown or the bridge gets attached to. So our New Teeth Now procedure looks something very similar to this. So we put in typically 6 implants on the upper jaw, and those 6 implants enable us to attach the full complement of teeth, and that's one fixed big bridge that replaces everything in the upper jaw on those 6 implants. And the lower jaw is something very similar. Typically we do it on 4 implants. Sometimes I do 5, sometimes I do 6. My goal with every patient is to utilize as much bone as I can, and I try to put in as many implants as I can, as long as I'm not getting those too close together. More implants is always better unless they're too close together. If you've got them lined up where they're really shoulder to shoulder and there's not a lot of room in between them, then that can be a setup for a bad situation with the bridge. And I can talk a little bit about that, in a few slides. So also in this presentation tonight, which I hope helps you guys a lot, not only am I going to go through kind of from an educational standpoint telling you what we can do with implants, but I feel it's really important to hear from actual patients that I personally have treated and show you some before and after so you can see and get a really good idea at what we can accomplish with the implants. Like this gentleman, Mark, he came to us and he had a lot going on in his mouth. He did not want anything removable. He did not want a denture, nothing like a partial or anything that he's going to have to take out of his mouth and set on a nightstand. every night. He wanted implants. He wanted a fixed option that was screwed in and never comes out. So he came in and we were able to do this procedure on him. And I'm going to let him tell his story just on a short little video, which I think you guys will enjoy.
My teeth actually got to the place where they were moving in my mouth, and I didn't know it. And so my teeth were moving around as I talked. And I had some people actually make fun of me. And I didn't know what they were laughing at until I looked in the mirror one day and I just started moving my mouth and I saw my teeth moving. And I thought, oh my God, this is bad. And then you start lacking confidence, you know, you cover your mouth, you don't want people to see. That pushed me closer to New Teeth Now, because I gotta get something done now. So when I saw now, I'm like, now is what I need. So I was made to feel comfortable right away. I didn't have to warm up to it. And I just knew New Teeth Now was where I was supposed to go. So they're prepping me and he's asking me about my music. So I'm thinking they're gonna start counting down, you know, when I'm gonna go to sleep. And next thing I remember, I'm waking up. I'm waking up and I'm like, is it over? Have you guys have already done the work? And then they gave me a mirror and let me look at them. And when I looked at those teeth, I was like, oh wow, I finally have teeth and can be proud of the way I look. To look in the mirror and be able to smile and see the smile, the warmth. My wife cried, and I felt like tears myself, because it was just such a special moment to have not gone through all the time that I've had to fight trying to keep my teeth, brushing them and flossing them and whatever, and nothing seemed to help. And then to finally have the teeth put in was just very, very special. I'm just a chicken when it comes to pain anyway, so I didn't want to feel anything. So the actual surgery, I felt nothing. I was out, and when I woke up, I had teeth. So there was actually no pain when I had the surgery done. Coming out of the surgery, and I was numb, so there was no pain there. I was able to go on with my life, because as being a music minister, I had to be back on my job that Sunday. I think it was maybe that Monday I had the work done. So by Sunday, I was back doing my job. New Teeth Now, as it relates to work and what I do, has had an incredible impact, because, again, it's the confidence in knowing that, you know, you can be personable, you can get close to people. You know, of course, there was a self-consciousness even about your breath, because you're fighting the gum disease and that kind of thing. So now I can look people in the eye, smile, be closer, and not have to feel like, oh, what are they thinking? You know, do I look okay? Does my breath smell? Whatever. So now I can just go ahead and speak up. My voice sounds okay. I think I sound okay when I talk. But now I can enunciate and open my mouth and not have to feel self-conscious about the way it looks. So before New Teeth Now, if I did a selfie on social media, you know, I might smile, but I probably wouldn't show much teeth because I didn't want anybody to see the floss. But now with New Teeth Now, I can smile and do the selfies and hold the phone up there and like, eat your heart out, guys. New Teeth Now have given me teeth that I actually feel like they are a part of who I am, and make me feel like, yes, these are my teeth and nobody can take that away from me.
All right, so you kind of heard Mark's story, and then if you look at his before and after picture, it's pretty impressive to know that, you know, it had that much of an impact on him and his just life in general, that he really doesn't have to think about, you know, his teeth anymore. And while we were on, you know, while that video was playing, Bianca let me know that a question came in, which we love when people submit questions. And Bianca, go ahead. Let's go ahead and answer one.
So this person asked, are the crowns replaceable independently as needed?
So it depends on if it's an individual implant and you're just replacing one tooth, then yes, the crown would be replaceable in the future if something, you know, happened. With this New Teeth Now procedure, like what Mark had, when we're replacing everything in one everything in one jaw? No, they're not replaceable because they're all connected. It's one piece. So there's not individual crowns, which does a couple things in a good way. It makes them very strong because they're milled from one piece of zirconia, and they're not individual teeth. So they're all connected. So when you're chewing on the right side, then all the force is sort of getting evenly absorbed by all the implants in the jaw and all the teeth connected to those implants, which function-wise sort of protects them and should make them, that's what makes them so successful. The bridge is replaceable. So, just for an example, I had a patient that had a car accident after they'd had this procedure done, and it broke a couple of the teeth off of the bridge. It actually broke the bridge. So we were able to just make a new bridge. So it is replaceable, and the implants weren't damaged. It just, unscrews, and we screw a new one on. So I hope that answers the question. It's a little different though than like a single tooth replacement or a single tooth crown on a tooth or a single tooth crown on an implant. With this new teeth now procedure, they're all connected. Was that the only question?
We actually had 2 more come in if you want to answer those.
Yeah.
So this one is describing the temporary teeth. Are they dentures or flippers at all?
No, so the temporary teeth they're different than the final teeth, and I'm going to get into the materials, a little bit later in this presentation. But your temporary teeth, they are acrylic, but they're still a screwed-in bridge, and they're screwed in. They can't come in and out. It's nothing removable. It's not like a denture where it covers the roof of the mouth, or it's got the wings that go up in underneath the cheeks or the lips. It's still one big bridge, and it's still screwed in and sort of fixed, non-removable, but the material is acrylic. And one of the reasons that we keep it that way is we know that it's temporary and you're only going to be wearing it for 6 months, around 6 months. But it's very easy for us to adjust. So acrylic is super easy for us to adjust the occlusion, because when you're changing everything in your mouth or everything in one jaw, we want it, we're going to repeatedly be checking your occlusion, the way your teeth come together when you open and close your lower jaw. And we want it to where everything touches evenly on both sides. And with having an acrylic, it's super easy for us to adjust that. So when it comes time for you to transition into your final restoration, which is made out of zirconia, then we already know exactly where your muscles are happy at. So it's acrylic, which is the same material that a denture or a partial would be made out of, but it's way different than that. It's screwed in, and it's one big bridge. And what was the other question?
So the last one for now is from an out-of-state patient. How many trips approximately from the beginning to the end of the process?
So great question. And we have a lot of patients that come in from out of town, out of state, out of country, and we do everything that we can to minimize the number of appointments. We try to combine a lot of the appointments where we're not accelerating the process, because I think that's a bad way to put it, but we're combining where if you were in town or somebody that lived, within a short drive from here, we may schedule your appointments where there's more appointments, but they're really quick appointments, where if you're out of state or out of the country, you may be here more than half a day, and a restorative team in the lab would be doing a lot of different things, getting you maybe 2 or 3 appointments into one. Basically though, just to give you an idea, I would have to see you for the consult and then surgery soon after that. So sometimes we'll have it set up for out of state or out of country patients where you would come in for a consult, say on a Monday. I could do your surgery on a Wednesday. And then I like to see everybody about 1 week out of surgery, just to make sure everything's healing okay before you leave the state and get out of my control. So you're looking at 3 appointments there. The consult, which obviously we have to do because I've got to see you and do an exam and get a CT scan to go over that to make sure that you're a candidate for this procedure. Then we obviously have to do the procedure. That's the second appointment. And then I need a follow-up, because I can't just do the procedure and turn you loose and expect you to know everything to do after that. I need to make sure that everything's healing okay and you're doing, your part with keeping everything clean and you're comfortable. And then after that, if everything looks good at that first post-op appointment, then I can really play with the timing of the next appointments. And typically, I may see you one more time before I release you to start making the final teeth. And once they start that final process, it's another 2 to 3 appointments to get into your zirconia teeth. So at minimum, there's basically 6 appointments. 3 of those, though, would be knocked out like within basically a week of you coming for your consult, a week and a half of coming for the consult. We try to minimize it as much as we can and make it super simple, because we have a lot of patients that do come in to have, especially the zygomatic implants, which is kind of a niche that we do. Not a lot of people in the US, not a lot of people in Europe do them. So we get a lot of people that come in for that particular treatment. I hope that answers your question, but we kind of curtail it and customize it for every patient and do anything we can to make it as simple as we can for you. Any other questions, Bianca?
Not right now.
Okay. So why new teeth now? Like, why do patients come in from, in town, out of state? Well, number one should be to restore your total body health. The mouth is a very big part of the body. In the past, I think historically, it was forgotten, and you'd go in for a physical exam or your yearly exam, and they would look at everything except your mouth. Maybe they would take a popsicle stick and just have you to, stick your tongue out and say, ah. Now, primary care doctors are really taking a good look at your gums, your teeth, the mucosa, which is the skin on the inside of the mouth. And they really want to make sure that your mouth is somewhat healthy, because there's a lot of evidence coming from the universities, and it has been for the last 15, 20 years, where periodontal disease in particular is definitely related to a lot of the other organ systems. It can increase your chance of, having strokes, having a heart attack. And I'm going to go over that stuff in a little bit, but it's very, very important to be aware of that and know that if you have that, you need to restore your total body health. Improve self-confidence and bring out a smile. That's really simple to see and for me to tell you about. You could see that with Mark. Just look at his before and after picture. He didn't want to smile ever before he had this procedure because he was ashamed of his teeth and they hurt. So, he had this procedure now, he doesn't have to think about that. He can just focus on other parts of his life. Definitely increases your ability to eat foods without pain. You are asleep during the entire procedure. So for you patients out there that are, scared of the dentist or, dental chickens, then this is the place for you to come, because you are totally asleep under true general anesthesia. You wake up and you're finished with all of the teeth coming out. Your teeth would come out if you have teeth. The implants would go in, and all the impressions and all that stuff would be done when you wake up. And the postoperative pain level will definitely surprise you, because it surprises us every day. It's very common for us to hear that a patient had this procedure done, and when I see them back a week or so after the procedure, and they're telling me, what they experienced and how the initial recovery was, and they're like, yeah, I did have some swelling, I had some bruising. Sometimes you do, sometimes you don't have swelling and bruising, but the pain really wasn't that bad. I did take some Advil, but I only had to take one of the Percocets, which is the narcotic that I typically give. So that is a really good thing to hear, and that's pretty common and typical for a lot of our patients. So the oral body connection, I kind of touched on this a little bit, but one of my quotes that I usually tell patients is, if you're thinking about doing this, you need to really think about how it's going to affect your body. because the mouth is the gateway to a pretty awesome creation. You know, it's the first thing that encounters the air that you breathe and the food you eat, and both of which keep you alive, by the way. And, you know, if you have periodontal disease or severe gum disease, then that's a low-grade chronic infection your body's always fighting. And that can increase your chance, like I told you about, increase your risk of heart attack, stroke, a bunch of the respiratory or the lung diseases, a bunch of the stomach, GI problems, diabetes, osteoporosis. But, you know, when it all comes down to it, it's a low-grade chronic infection that your body's always fighting. And the longer your immune system is in overdrive trying to fight that and help your body out, it can reduce the effectiveness of your immune system, which definitely can shorten your life expectancy. So it's a big deal. And primary care doctors are very well tuned to this now, especially the newer ones coming out of school. If they see red bleeding gums, they're going to definitely recommend that you come see either your general dentist or an oral surgeon. Periodontal disease, this is a picture of what it looks like. And this is a very, very mild case, by the way. You know, if you look at this patient's, the before picture, yes, there's a lot of bone loss and a lot of gum recession. So you can see the crown, the really darker structures are the roots of the teeth. That all should be covered with bone and gum. So when it's not, because of periodontal disease eating the bone away, these surfaces, they're not protected with enamel. They're super sensitive to sweets, hot liquid, cold liquids. And there's all this infection going on underneath the gums. He was doing a pretty decent job at trying to keep everything somewhat clean. That's why his gums have that light pink look to them, which is what we want to see. And they're not cherry red and bleeding and swollen. But if you look after, this is the same day. So before, after, all the teeth out, the implants in on the upper jaw that you can see here. Periodontal disease instantly gone that day, from the difference between here, periodontal disease, here, completely healed, no periodontal disease. So you can take a patient from here to here in about 1 month and perfect, nice, healthy gum tissue around those 6 abutments connected to the implants. And here is his before and after. So periodontal disease before and after with his implant bridge secured. Got a different hairdo. He left his man bun and his periodontal disease out and came back with a healthy smile. And I mean, I think his teeth look great. They look super natural. And if you didn't know he had implants, no one could just pass him on the street or be eating dinner with him and ever know that he had all of his teeth out and these were my implant bridge. So if you want to be truly healthy, you must restore your oral health. So who's a candidate for this procedure? This I talk about every day when I see patients for consults. You know, and I tell them that, you know, one of the things that I really want you to get out of this consult, when you're spending your time coming in to talk to me and, you know, let me do a clinical exam, looking in your mouth and going over your CT scan with you. And, you know, the number one thing to get out of the consult is, are you a candidate for the procedure? And do you have enough bone to do the procedure? So who's a candidate? People who have no teeth or they're unhappy with their dentures, people who have a mouth full of bad teeth, people who have a mouth full of severe periodontal disease. And especially if you've ever been told that you don't have enough bone for dental implants, I would strongly encourage you to come see me for a consult. I've been here since June of 2007, and I have yet to have a patient that could not do this procedure because they didn't have enough bone. So another before picture, you know, if you look at this, before, severe periodontal disease, he's got infections around the tip of his roots. If you look at that little black dot kind of right there on his gum, that's where an infection from that tooth has been brewing basically at the root tip. And it started to eat its way through the bone, eat its way out of the gum, and was draining into his mouth. That's a pretty bad infection that there's no way to fix except get rid of the source, which is the teeth. So we ended up taking all of his teeth out, putting implants in, and that's his before and after. And he had a really big personality before. And so you can imagine what it did to take him from this to this, where when he smiles, he shows big, bright, white, beautiful teeth, which is what he chose, by the way, because you have a big say in what you want your teeth to look like, especially when it's all said and done in the final zirconia bridge. And I think they look wonderful. You know, they look natural, they look great. It just looks like he has great teeth. This is another patient of mine who had dentures. You know, she didn't have teeth, she had dentures. So these don't look terrible, but they are dentures. And she was tired of doing something that was removable. So another lady with complete denture on the upper jaw, partial denture on the lower jaw that snapped onto 2 implants. A good treatment. You know, an implant over denture that's snapped on to 2 implants is way better than a conventional denture, especially on the lower jaw. But her implants started to fail, and she was tired of having something that comes in and out. So she wanted something more fixed. She'd been to see several different oral surgeons, different dentists, and no one could help her. They told her that, you know, we're sorry, you don't have enough bone for implants. We'll try to adjust your denture, and you kind of need to get used to that. Well, she somehow found us, and I'm glad she did. And she came in and she's like, you know, I'm just here for one last consult, and basically you're my last hope. I just want to know, because you said on your commercial that if I didn't have enough bone for implants, to come see you. So I'm here, and can you help me? And we went through a consult, and we could help her, you know, and we did that with the zygomatic implants, which they allow us. They're one of the greatest things that's ever been invented and kind of available to us to have in our little toolbox of things to use on patients when you really don't have a lot of bone. These bypass the areas where there's not enough bone. We can anchor them into the lower portion of the cheekbones. So they're solid, they're super secure, and they give our restorative team in our lab a great foundation to build a full arch secured bridge. And if you look, here's her denture in her before picture. Here's her after with a screwed in bridge that never comes in and out, and she can eat anything she wants. So it's a really, really good thing to be able to offer patients. And you can do that with no bone grafting. So you don't have to do the bone graft. You don't have to. And to do the bone graft, you got to take bone typically from a patient from somewhere, usually the lower portion of the leg, the hip, or cadaver bone, and you put wherever it's needed and let it heal. And it usually takes 7 or 8 months for the bone graft to consolidate or fuse and get hard enough for us to be able to put implants in. With the zygomatic implants, we don't have to do that anymore. We don't have to do the bone graft. We don't have to take the bone from a patient. We don't have to wait on the bone graft to heal. We can put these zygomatic implants in, and you get the teeth on the same day. I mean, it is one of the best things ever, and it's something that really sets us apart from a lot of other places, because if you can't offer this procedure or you wasn't trained to put these zygomatic implants in, then it really gives us an advantage to be able to help a lot more patients that other people can't. And, you know, this lady, she came in from the northeastern part of the United States because she knew she needed zygomatic implants. And she couldn't find anybody up in that area. No one in the New York, Philadelphia, New Jersey area could do this for her. So she flew to Florida. She spent a couple weeks on vacation in, you know, great weather, and had her procedure. And here's how I did that. So this is her after, with her bridge screwed in to her 4 traditional implants that you can see here, and the 2 zygomatic implants in the back. That's those longer implants, and they anchor, like I said, into the lower portion of the cheekbone. And I've actually got a little video that shows you exactly on a 3D image where these zygomatic implants are placed. And I think that does a really, it's a cool way for you to see at home exactly what we do with these implants. you can see on this 3D skull, this is the zygomatic implant. These are the traditional implants. And the bridge is screwed into the implants, just like it is on anything else. They're the same thing as a dental implant. They're just anchored in a different area. So they bypass where, this patient or this drawing of the skull and the patient you saw before, if they don't have enough bone back here, which is a very, very common area for patients not to have a lot of bone, especially where the sinuses are, then, in years past, 25 years ago, before zygomatic implants were around, or if you saw someone who couldn't do zygomatic implants, then you had to raise the sinuses, bone graft underneath, and let that heal for 7 or 8 months, and then come back and put a traditional implant in. Now we can just bypass that, anchor them into the lower part of the cheekbone, and secure your bridge on those zygomatic implants. We can even go as far as, like this patient, who has basically no bone in the upper jaw. And we can do that with 4 zygomatic implants. It's called a quad zygomatic implant case. I actually found just a tiny bit of bone here in the front, which, as I said earlier, if you have bone, I'm going to use it as long as I can space them out, because my goal at the end of every case is to do the best job I can on everybody, just like you're a family member, and get as many implants to give you as much support as I can. I never want to have to operate on you again. So I want to get it right the first time and have it at the end of the day, you've got support where you can have a bridge that should last you it's designed to last you forever. We don't really know exactly how long they last, because the zirconia to be able to do a full arch bridge has only been out since the end of 2009, beginning of 2010. Zirconia has been around for a really long time, but to be able to do the full arch bridge has only been around since then, for the last, basically 12 years. So we know they've lasted 12 years without showing hardly any signs of wear. No one knows how long that they actually will last. All the data points in the direction for a lifetime procedure. But truth is, we really haven't had anybody to wear it more than 12 years, because that's all it's been out. And then Bianca did tell me that we had a couple more questions. So I think now's a good time, before I get into the total facial makeover, to answer some more questions.
Yes, so you actually did go over one of the questions, which was about bone grafting and zygomatic implants. So that one's covered. But someone else had asked, can you floss the teeth?
No, that's a good question, and that's a common question that we do get sometimes. You cannot floss these because they're all connected. It's one piece all the way around. So you don't floss in between the individual teeth. Even though they look like you can floss there, you can't. It's no different than any other bridge, that if you're missing one tooth and a dentist makes a regular bridge that connects, to the 2 teeth on each side of the missing or the space, but you can floss or water pick underneath the bridge. Our preference is that you use a water pick. We like that so much that we actually give you one with this procedure. But it does a really good job at flushing between the bridge and your gum, kind of in that area, in this direction. So you're not kind of going up and down in between the teeth. You're just going in between the gum and the bridge. Because if you think about it, the most important part for you to keep clean is your gum tissue, the skin on the inside of your mouth. And that we recommend, and we give you a Sonicare toothbrush, which is an electric toothbrush, and a water pick. But that's a good question. We get that all the time. Any other questions, or should I go on with the next portion?
Not at the moment.
Okay. So stop me just like you're doing, and we'll answer those as they come in. So the New Teeth Now Total Facial Makeover, another portion of my practice is facial cosmetics. And, that ranges anywhere from basically your hairline to your neck. That includes brow lift, eyelid procedures, rhinoplasty, cheek implants, different than the zygomatic dental implant, like a silicone cheek implant to give you that more prominent cheekbone appearance, facelift, neck lift, and a lot of, of course, some fillers to enhance the lips. And along with that is I can do a lip lift, which can be done at the same time as a lot of these procedures can be done at the same time with the implants, which is pretty cool when you think about it, because you can come in and not only have your total mouth reconstructed with dental implants and new teeth, but you can also have some of these various cosmetic procedures. I can do eyelids is a very common thing that we can do at the same time with this new teeth now procedure. I can also do C02 laser resurfacing of the skin, which I'm going to show you some pictures of in a minute. The lip lift procedure, so we can make your upper lip especially look more plump and give you more of a border where, like the red line where your lipstick would go. So there's a lot of things that we can do at the same time. Like this lady, she came in to see me for an implant consult, and she, while she's in the office, she saw one of the pamphlets and realized that I do cosmetic surgery. And she was like, "Ooh, what can you do something about these sunspots?" She grew up in Florida, as a lot of us do. We're outside a lot, enjoying the weather. She had a lot of sun damage, fine lines, wrinkles, sunspots. And the day that I did her implant, so you can see the before of her teeth and the after of her implant bridge. Those are her temporary bridges, by the way. But I also did a CO2 laser resurfacing. This picture is about 3 weeks after that. And what it does is CO2 just resurfaces, basically peels away the top layer of the damaged skin and the fine lines and wrinkles. And so if you look at her, she looks totally refreshed, almost like this lady's younger sister. A lot of the fine lines and wrinkles are gone, and the sunspots have basically evaporated. So it's a really cool treatment to do with this new teeth now. Facelift, if you look at the neckline, and her neck in general, cheeks, everything's kind of lifted, a little more younger appearance. Another facelift and neck lift. I do not ever, and she also had a brow lift, but I never want to put somebody into that true plastic surgery wind tunnel look. I just want to take 20, 25 years away, where it makes you look a lot more refreshed. If you look at the jowls here, definitely a significant improvement in her neckline. And I wish I had her profile because it shows a really, really big difference in her. She had the common term that we would use is a turkey neck deformity, but just a lot of submental fat is more the medical term that I would use. But that we tightened that and did liposuction of her neck. This young lady, chin implant, a silicone chin implant she had a really retruded chin, and it was set so far back that she had to strain her mentalis muscle, which is this thing, that's what's given her the dimpled appearance there, where she's straining to close her lips. Here, it's more relaxed, definitely more prominent in the chin. And then, with dental implants, we kind of put some slides in that go over some of the more common questions, some of which you guys have asked about flossing in between. But a lot of people ask, well, will I ever need another root canal? Well, no, because they're fake. There's no root, or there's no real tooth roots left. So there's no blood vessel or nerve running inside of the implants. So you do not need a root canal ever again. They will never decay or get a cavity on them because they're fake. And they are very easy to maintain. I kind of talked about that using the Sonicare toothbrush. You brush them twice a day, just like I do my natural teeth. Use a water pick instead of dental floss. And one of the things that's really common with this procedure, and what I would do, or anyone that still has their natural teeth, we highly recommend that you go get them professionally cleaned every 6 months. We want you to see a dentist, have them taken out. They clean them. There's no numbing. You don't have to go to sleep for that. Super quick and easy. Takes a couple minutes to get the teeth out. They take them in the back, steam clean them, put them in their ultrasonic cleaner, and it basically makes them look brand new again. And then they get a good look at your gums, make sure everything looks good, stay in healthy, that you're doing a good job keeping everything clean, and screw the teeth back in. It really doesn't get any easier than that, especially to keep these things clean. There's a couple different things that differentiate our new teeth nail procedure from other places. And it's super important for you guys to know this. This you can call back in and go over this, with you over the phone, or especially when you come in for your consult. But board certified oral surgeons, I can't stress how important that is. The experienced team that, basically this is all we do. So my surgical assistants, Dr. Richard's surgical assistants, and, we have a new surgeon with us, Dr. Rintel, who will soon be doing these. But the entire team is super experienced, and we all have the same goals, and we all know that it's a team approach. I can do the best job I can with your implants, but if I don't have a good team supporting me at the office with my assistants in the lab and the restorative doctor and a patient who really understands how important it is to help keep everything clean, because that plays a big role in the overall success as well. The experienced team definitely is an important differentiator with us. Doing this procedure under general anesthesia compared to trying to numb somebody up and do this awake, or to do this under IV sedation, totally different. General anesthesia, the patient's totally asleep. We've got control of the airway. It's the safest way possible to do this. And it's the easiest way for a patient to come in and undergo the procedure. Having everything under one roof is also super important, from your dental, basically our phones, the people you talk to on the phone to schedule your appointment, your consult, my implant coordinators. When you come in to see either me or Dr. Richards, all of our implant coordinators are in-house. They're in the same building. Your consult would be in our building. Your surgery would be in our building. Your follow-up appointments would be in our building. Your general dentist, the restorative doctor is in our building. The lab is in our building. Everything is here. So you come to one place for everything. Having the lab and the restorative team here in the same building under one roof, where you don't have to come here for surgery and I send you over, across the street or down the road or a few miles away to the general dentist office, and then they send you a few miles away to the lab to let the lab technician look at you, is super important. When the lab tech can come out of the lab into one of the clinic rooms and just take a look at your face, the shape of your face, the skin, your skin tone, your mouth, how you smile, how big you can smile, that is invaluable. The zygomatic implants, I told you earlier, not a lot of people in the United States, not a lot of people in Europe do this. There are some people that are doing this, and there's training programs that are teaching it. There's just not a lot of people who get out, even if they were trained to do it, have the patients to walk into their office that need this done. A lot of people want to go to a place who that's all they do, like here. So we do a lot of zygomatic implants. And then the final teeth being in zirconia is also something that is very important. Zirconia is a different animal for your final teeth. It is the strongest material, and it's the most cosmetic material that anyone has to be able to replace everything in your mouth with one bridge. The all under one roof, like I talked about, the consult, the impressions, the surgery, the in-house lab, the final teeth, everything is here under one roof, the all in one day. The procedure is done literally in one day, whether you have teeth or you don't have teeth. If you have them, we take them out, put the implants in. If you don't, we put the implants in, take the impressions, send them up to our lab, and our lab gets the teeth ready for us to screw in that same day before you leave the office. The temporary teeth are made out of acrylic, like I told you earlier. We know they're temporary. They're only going to be in there for, basically 6-7 months. They're easy to adjust, and the final teeth are made out of zirconia. One of the two main reasons that we wait and not give you your final teeth very soon, like the same day or the next day after surgery, for a couple reasons. A, it takes a little time to make the zirconia, but more importantly, we want your implants totally healed to the bone before we put your zirconia on. And the most important thing is we know as you heal, your gums are going to shrink. So for that first 3 to 4 months after surgery, when your temporary teeth are on, your gums are going to shrink. You're going to get a space in between your teeth and your bridge and your gums. You're not going to like that. We know you're not going to like that. That's why we wait and make your final teeth after that whole process of your gums shrinking has completed. Then we make your final teeth to butt up and touch the gums again. And then that seals that space. You're super happy and you've got the best restoration that you could possibly have. The consultation, when you come in to see me for the very first time, it's usually about an hour appointment. We get an iCat, which is a CAT scan of your face, and then we go over that together with you. So you see exactly what I'm looking at. You know where I'm going to put your implants. You know how much bone you have and where your best bone is. And we use that to help develop a treatment plan that you leave the office with that day. When you come in for implant consult, you'll meet with me and one of my coordinators. Here are the 3 that we have. I can't say enough about these 3 young ladies, Shauna, Debbie, and Mara. They are super experienced, very knowledgeable. And, typically by the time I even get in, they get you back into the consult room. They take your CT scan and they go over a lot of the beginning stuff about the procedure. Most of the time when I come in the room, I'll start talking to a patient about, a certain process or showing you something on the scan. They're like, oh yeah, Mara showed me that. Oh, Shauna already went over that. Oh yeah, Debbie told me you'd probably talk about that. So it's almost like that I come in, you've already had your consult with one of the coordinators, and I'm just verifying, which is a really good thing because you're hearing it twice. And it gives you confidence that these 3 young ladies really know what they're talking about. The same with our restorative team, Dr. Nafala, Dr. Dibbs, and Dr. Sorrento. They do these procedures pretty much every day, where they're taking impressions on patients who are scheduled for their surgery in the upcoming days. They are taking impressions to start making patients' final restorations, after the 6 months that we've released them from a surgical standpoint back to this restorative team. And they are very experienced. And I bet if you could probably combine all the other restorative dentists in the United States, all of them combined, I bet have not done as many full arch restorations as these 3 have. Just these 3 people here in their one location have done more than probably everyone else in the US combined. And I say that very confident because we know a lot of the implant reps, so we know who's doing what. And that is something I'm very confident in. So Dr. Dibbs, he does a really good job on a short little video that I'm going to show you about how important it is, and for you to know, and you'll learn this when you come here and go through the process, but just how important it is from a restorative and a lab aspect to have everything here under one roof. So I'm going to let Dr. Dibbs take it away.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Put up this picture just to show you, obviously you're looking at me on the camera, but that's me and my surgical team. And they are, they're all three outstanding. I love them all. They make my job a lot easier, which in the end makes the process for the patient as good as it can be. They know exactly what I'm going to be doing like 30 seconds before I ask them, usually for an instrument. They've already kind of got it laid aside or getting ready to hand it to me in surgery, or if they're seeing a patient for one of the post-op appointments and they're seating you and they come and tell me like what's going on and how you're doing. They're very thorough and very, very good at helping patients through this process and contribute a lot to the whole team approach. Bianca, you said that we had some questions coming in. What's happening?
Yes. So the first one is, how is the zygomatic implant placed? Does it go through the sinus?
No, it's very, very close to the sinus. So it rests kind of just right on the outside portion. We try to stay out of the functional sinus, but it anchors into the bone of the lower part of the cheekbone, traverses across the sinus, and then anchors into the little portion of the upper jaw in that area. But everything is placed exactly the same way it would be if it were a regular implant. It's just angled in a different direction.
Perfect. Will food get stuck in between the gums in the teeth?
Yes, the same way. So that's a good question. But yeah, I mean, there's going to be a space there. There's going to be little crevices, somewhere in this bridge, either in between the teeth or around between the bridge and your gums. But just like me, when I go out, I go out to eat with my wife and kids, and they're no holds barred with me. I mean, I've got all my natural teeth, but every now and then one of my kids will look at me and laugh and say, "Oh, you got a pepper tooth," or something stuck in between your teeth. And same thing, you may get something stuck in between your bridge and your gums. You can usually swish some water around or whatever you're drinking around, and that gets that cleaned out. Or when you get home, you brush or water pick it out. So yes, things get stuck there. It's not something that is a problem where like every day that's what you're dealing with, but occasionally you're going to have something to get stuck in between the bridge and the gums. But it's something that's very easily cleaned out.
Perfect. Can you recreate a front gap on a person's teeth?
Yes, you can. I don't know who asked that question, but I have had actually a couple patients that have come in where they've had, a decent space in between that you could fit like a cigarette in between their two front teeth of the upper jaw. And I guess I probably shouldn't say cigarette, like a pencil eraser, about the same size. And having that gap there, one patient in particular, this was a no-go for him. if we could not recreate that space in between his two front teeth. He was 91 years old when I did the procedure, and he'd had that gap in between his two front teeth for as long as he had his teeth in his mouth. That's what he knew when he looked in the mirror. That's what his family and his friends, knew him by. So he wanted his new teeth now bridge to also have a gap in between the two front teeth. He wanted his teeth to look the same. He just wanted healthy teeth. And that's what we were able to accomplish for him. So yeah, we can recreate the space.
Awesome. For bone loss on the lower gums, what options are there for that?
For bone loss on the lower gum, so in the lower jaw, I'm not going to say 100%, but it's very close to 100% that we can do this. Actually, I'm trying to remember if I've ever had a patient that I could not do on the lower because of bone. Obviously the lower jaw moves, so you can't attach it to a fixed zygoma or cheekbone. Otherwise, your lower jaw, you wouldn't be able to talk or eat. But people typically have enough bone on the lower jaw that we can find ways to use traditional implants to be able to do a setup to where, we can make the fixed bridge on traditional implants in the lower jaw. Matter of fact, I don't think I've had a patient that I could not do the lower jaw. It's usually the upper jaw is almost always the problem with bone loss and implants.
We have a couple more.
And I will
We're just
add
flying in tonight.
Okay. Let me add one more comment to that answer. Too, I've had several patients come in that tell me that they were told they didn't have enough bone for implants in the lower jaw. But when they come in and we do the CT scan and we're going over that CAT scan with you as the patient, it's very common for people to tell me like, oh, well, the oral surgeon that I saw, he only had that panoramic x-ray, which is a two-dimensional picture. And sometimes it's very different. We can find a lot more bone when we're looking from a 3D perspective with our CAT scan. I just wanted to kind of add that in. So that's having the CT scan makes it a lot easier and it takes all the guesswork out.
Yeah, that makes a big difference. So this patient asked, can the teeth be recreated to look like their former natural teeth?
Yeah, we love that. So when patients come in that, they want to look natural, they want to look like they used to. If you can bring us a good picture, we can try to get as close as we can. Now, are they going to be the same? Probably not. But we can get really, really close to, from the shape, the size, the color of the teeth, that what you ideally would want. And it can be what you had in the past, or it can be a picture out of a magazine, or you could bring us, some celebrity or a friend that that has really nice teeth or teeth that you think are attractive. You can bring a picture of them in. If we have an up close picture of the teeth, then we can try to get as close as we can to recreating that for you.
And our lab is really, really good at that. They're like artists. And then the last question is more about like dental anxiety or a patient that's more emotional and sensitive about their struggle. How do we handle that?
We handle scenarios like that every day. And I think our staff is, that experienced team that was one of those differentiators that plays a big role. I mean, we are used to seeing patients who are very emotional because this is it's a big deal. It's not like you're coming in or you have one tooth in the back that's, needs a crown. When you're replacing everything, the reason you're replacing everything is that it needs to be replaced. And we know patients that are in that condition can be very, very emotional about their situation to the point that it's something that's just affecting their daily life all day, every day, from going out to dinner with friends, or maybe you don't go out to dinner with friends anymore because you don't really want them to see your teeth when your hand is not like this, talking to your friends when you're out in public or trying to move things around or, take a piece of paper and kind of cover because of the appearance of the teeth or the way the teeth hurt when you're trying to eat. So we are very, very cognizant about patients and their different emotions that they may or may not have when you're coming in to even discuss. We know it's a huge step to get you to open the front door and come in our building. And I feel like that our team on the phone can be very helpful in that process of making you feel comfortable enough to get you in the door. And once you come in, I feel like you will definitely be comfortable with us and with our staff here, because everybody pays attention to that. You know, we want people, I mean, our team is, we want you to be comfortable that you're here. We want you to be comfortable in the consult. We want you to be comfortable in the surgery. And that's one of the main reasons you're completely asleep under general anesthesia. You know, it makes it a lot easier for the patient. And speaking of anesthesia, this is our basically the core of our anesthesia team. They are very, very experienced, as you can see from the slides. Every anesthetist that we use has a significant amount of experience in a hospital setting, and most are used to living in the heart room, the heart operating room at the hospital. So that means that they are very comfortable and very good at what they do. You can see they've got, you know, and those pictures are a couple years old, but so it's even more than 30 and 25 years of anesthesia experience. And, you know, I mean, who better to put you to sleep than Jack Daniels? I mean, that's his actual name. So when you got Jack or Kim or Steve or Ashley coming in to guide you through the anesthesia process to get you nice and comfortable and asleep, you know, they're a huge part of the team. And it makes you very comfortable when they're not only compassionate, but they're very good at what they do. And then our whole team, when I told you it takes the entire team plus the patient to be successful, well, this is it. You know, as you can see, we've got a lot of people that work here with us in Lakeland at our office. And that is, each and every one of these people are very important, and it cannot be done without them. From the doctors that you see in the middle, and you know, we're there in the middle, but we're no more important than anyone else in this picture. From the surgical assistants to our insurance team, to our schedulers, to the people you talk to on the phone, to our marketing department, our advertising, our IT department. I mean, our marketing, advertising, and IT are, and Bianca on here with us, that's how we're able to do this webinar, to help get information out to you as the potential patient. So it really takes the entire team to be really successful doing this. Any other questions before I show Cheryl?
No, we can watch Cheryl now.
Okay. So Cheryl, another patient that just has a good story, and I'm gonna let her again run through a really short video and just kind of give her experience of her time here.
I was in an auto accident when I was 19 years old, and that damaged my front teeth. And I had a partial bridge then, and then unfortunately back then, when they did partial bridges, they only used those wire clasps, and because they're on the front, it wore my other teeth down on the sides, and then pretty soon it just got to the point of having to have root canals, caps, and then a bigger bridge. When I look at someone, instead of looking them in their eyes, because I felt my teeth were so unattractive, that the first place I constantly look is their smile and their beautiful teeth, and just, you know, in the back of my mind thinking, I'd like to have that again. I think as a woman, and of course as a mother and having a large family, we do have 8 children, I think it was natural for me, and also because I'm a nurse, I always take care of everyone else first. I finally came to the realization that my family was grown and they're doing fine, that it was time for me. And it was affecting how I felt about myself. And I noticed also that it was affecting my children. You know, I'm 70 years old and I still want to look beautiful, and it's important to me. I just didn't want to take it away from my family. But my family's fine, and it was time for me. And my husband kept telling me that over and over. And like I said, until my children said, Mom, we don't see you smile anymore. That's what we miss. I saw an ad for New Teeth Now, and they were going to have a seminar. I was able to meet Dr. Kirkpatrick there and several of his team. It answered a lot of questions for me, especially speaking with Dr. Kirkpatrick personally, and I felt very comfortable. I made the decision that day to make an appointment. The day I walked in for my surgery that morning, of course I was nervous, even being a nurse, and I knew part of what the procedure would be. I was put totally at ease when I got there. And that was comforting to me. And as far as from a nurse's perspective, I want to say that I was so impressed with the entire staff, the facility. I felt comfortable. Everything was clean and sterile. Everything I had seen at New Teeth Now just was beyond my expectations. And when I came out of the surgery, I didn't have any pain at all. The staff at New Teeth Now brought me into the room where I was going to receive my new teeth. Dr. Kirkpatrick was there, and he said, "You're going to get your new teeth now." So they placed the teeth in my mouth and handed me a mirror and said, "Well, what do you think?" And I looked in that mirror and I smiled, and I had the most beautiful smile I've ever seen. And I said, "Dr. Kirkpatrick, I can't thank you enough for what you've done for me. You have given me back my life. You not only have given me a smile, but you gave me back my life. And I can't thank you enough."
So, before and after, I was texting Bianca while the video was playing, and just how good Cheryl's teeth look. And for the person that asked me the question about can you floss in between them, you can't, but it sure does look like you can when you look at her teeth. And I think that's super cool because if you look at her before and after picture here, and the before obviously she's got a lot of stuff going on with her teeth, but that after, I think they look super natural. They look very pretty. I love the color of them, and that's what she picked. You may not want teeth that are that white. I like those on her, but man, I think that her after looks really good. I haven't seen this after picture until tonight, but that's pretty impressive. So, the process, we had a patient, or we had a question that came in about, the out-of-state, out-of-town patient, but basically here's generalized overview of our process. You come in for the consult. Next appointment would be for pre-op and impressions. If you're coming from out of state or out of the country, that can be done at the same time as the consult. We can have that kind of prearranged in certain cases. And then next step would be the New Teeth Now surgery, and then your post-op appointment and any adjustments, and then release you back over to the restorative team in the lab, place your final teeth, and then that just leads into your care and routine maintenance. Every 6 months, you go to either you come to our general dentist or you go to a general dentist of your choice, and just have them cleaned every 6 months and continue your life without having to worry about your teeth. And I know Bianca goes over some resources here in a minute, so I'm going to turn it over to her. But if you have any questions, I'm still going to be around for a couple minutes. Submit those, and if you don't get them in, don't worry about it. Call the number that Bianca is going to give you tomorrow or sometime this week, and we can hopefully answer them over the phone or set you up with a consult to come in and see me. But Bianca, I'm going to let you take over and go over the resources.
Perfect. Yeah, so if you do want to learn more, we actively use our upload videos on our YouTube channel, and I know a lot of you are watching through YouTube, so you can definitely, after this video, take a look at more testimonials. There are more webinars, just a lot of good information to learn a lot more detail. And for other resources, we also have our social media channels, Facebook, Snapchat, and Instagram. Sometimes Dr. Kirkpatrick posts live surgery if you're wanting to watch some of that. And then Facebook and Instagram, we have a lot of great before and afters, question and answers, just a lot of good info. So I suggest giving us a follow. But I really appreciate, me and Dr. Kirkpatrick appreciate you for watching this tonight and asking such good questions. We loved being able to answer all of those. But if you have tuned in this entire time, it sounds like this is a procedure you may need, and we are here to help. So please give us a call tomorrow, schedule that consultation, ask more questions. We are ready to walk you through the process and hopefully help change your life. We hope everyone has a wonderful evening.